Violence against children is a serious human rights, social, and public health issue in Tanzania, as in many other parts of the world. It erodes the strong foundation children need for leading healthy and productive lives and violates the fundamental right of children to a safe childhood. In Tanzania, the prevalence of violence against children has been exposed as a serious problem following the results of a 2009 Violence Against Children survey. The survey is the first ever in Africa to explore the full extent of sexual, physical, and emotional abuse against both boys and girls and its negative consequences. A national multi-sector task force chaired by the Ministry of Community Development, Gender and Children, and includes government representatives from education, health, social welfare, justice, and the police, civil society, and development partners, are collectively steering the research findings into action.
If you look at the main key findings, what we see is that over 28% of girls reported to have experienced sexual violence before they turned age 18. The corresponding figure for the males is 13%. Now, if we go to physical violence, the figures are even more alarming because 74% of girls reported to have experienced physical violence and 72% of boys had experienced physical violence. Now, when you go to emotional violence, what we see is almost 24% of girls had experienced emotional violence and 28% of boys had experienced emotional violence, indicating that this particular problem is prevalent in our society, although it hasn't been investigated before.
Tanzania has a new legal framework to respond to children at risk of violence and abuse. It's extremely timely. Linked to that legal framework is the development of rules and regulations. Rules and regulations means procedures. Whether it's a child coming into school, a child coming into the health center, a child visiting their social welfare officer, a child having contact with the police. Currently, there are no procedures for those sectors to know what to do if a child's been abused. And these regulations that come from the law define the procedures. They tell you when, who does what, and the clear roles and responsibilities of each actor.
As part of the national response, district child protection teams are being mobilized in particular areas as a first step to reinforce a national child protection system in Tanzania.
For the next 5 years, we are looking at a national costed plan of action which will be clearly addressing the issue of abuse and violence against children and guiding different stakeholders and different actors into the appropriate ways to intervene for protection for children. But also we are seeing a possibility of this information influencing policies, influencing national guidelines that we have, influencing the different instruments that we use as government.
Here in High District, in the Kilimanjaro region, a child protection team has already been established. They include the police, magistrates, health and social welfare officers, empowering local authorities to respond efficiently to cases of child abuse. 15 child protection team members work in close collaboration to ensure a child's case is given top priority and is heard in the court and resolved within 2 weeks. Behavior change in the community plays a huge role in protecting children. Cultural norms can often hinder the justice system as child abuse cases are often settled informally within a community setting. To combat this, the child protection teams are creating public awareness on child rights and abuse.
A commendable characteristic of this study is that even before it was officially launched, government and other stakeholders took steps to move from research into action. With the support of all sectors, there is a very real possibility that Tanzania will successfully address sexual, physical, and emotional violence against its children.
This is Jacqueline Mfour reporting. For more information, go to unicef.org, Unite for Children.